How's everyone feeling? Are you energized? Well, before we move on to our final session for today, I just want to thank all of you for taking time out of your busy days to join us. We appreciate your questions, your thoughtfulness, and your willingness to engage and learn from others. We're so excited for the new connections that you've made here today and hope you can take advantage of connecting with folks after this final session and stay in touch in the months to come. It is now my pleasure to welcome our final panel, The Future of Aging, Bright Spots in Policy and Practice. Thank you so much to Robert Espinoza, Distinguished Fellow and Senior Advisor at the National Academy of Social Insurance, for moderating this discussion.
Hi, everybody. Good afternoon. We have the joy and pleasure of being the final session for today's proceedings, and I am super excited for the conversation that we're about to have and to be joined by these remarkable leaders that are on our panel today. So often we hear about the kinds of challenges and the issues that are facing older adults and longevity and aging in general. And yet it's so critical for us to also think about best practices and solutions. And what does the evidence say about what we should do in order to improve aging for everyone? I want to take a moment to introduce my fellow panelists. To my left is Diane Tai, Managing Director of the Future of Aging at the Milken Institute. To her left is Jason Resendez, President and CEO of the National Alliance for Caregiving. And to his left is Ariel Galinsky, CEO and co-founder of the Legacy Project. I want to share just a few opening remarks. For 10 years, I worked at an organization called PHI, which focuses on improving direct care jobs, jobs for home care workers and nursing assistants who support millions of older adults and people with disabilities in a broad range of settings. When I was at PHI, I had the joy of serving on a panel for the National Academies of Sciences, Engineering, and Medicine on social isolation and loneliness among older adults. It was a year and a half panel where we looked at all of the evidence regarding social isolation and loneliness, including a really startling data point that loneliness can be as deadly as smoking a pack of cigarettes a day, right? There's something that has been understudied and really taken for granted about what a powerful impact it has on older people. The report came out actually a few weeks before the COVID-19 pandemic shut the United States, and I think in many ways it was foretold what was going to happen to many older people and people with disabilities in their homes or in congregate care settings. And one of the realities that I thought about, and our panel thought about, is that the report was rich with evidence and data and analysis. And yet the first or second recommendation of the report looked at what is all the research and better data we can collect to better evidence what it means to really improve the social isolation and loneliness facing older people. And I feel like a lot of us in our fields often see those dual realities. There's both a need to better study and collect better data to evidence and understand a wide range of phenomena that are affecting older adults and all of us as we age. And there's also a significant amount of evidence that says we actually do know what works. There are good practices out there that if we were able to really resource and scale, we can have a significant impact on the lives of older adults and frankly, all of us as we age. And that's what we're going to be talking about today. Jason, I want to start with you. You focus on family caregiving, and I know that there are a number of ways in which family caregivers can be supported. And I'm wondering if you can share with us, what are some of those evidence bases and programs?
Absolutely. So first, so great to be here with you and all of you in conversation. Thank you for including me in this dialogue. I want to start with some table setting. How many folks in this room are a family caregiver, caring for someone in your life, or know someone who is providing care for someone in your life? Wow. More than half of the room, I'd say probably 80% of the room. I'm always shocked but never surprised by the answer to that question, because there's over 50 million Americans in this country providing ongoing, demanding care for older adults, people with a serious illness or disability. Care is our common ground. From the moment we take our first breath, the moment we take our last, caregiving connects all of us. Yet we do so little to recognize and value and support those who provide care, especially through formal systems and investments. That is starting to change. That's the work of the National Alliance for Caregiving, is to champion system change to transform how we value family caregivers by investing in the infrastructure that's needed to make caregiving sustainable. My background is in Alzheimer's. I worked for over 15 years to try to cure Alzheimer's. We're not trying to cure caregiving. As long as we're here on this earth, loving each other, in community with one another, there's always going to be caregiving. And there's joy in caregiving. There's purpose in caregiving. But we have a system that doesn't allow for that care to be provided sustainably, with dignity, and equitably. Yet we're starting to see some bright spots in terms of movement and recognizing and valuing the contributions of family caregiver, particularly in healthcare. So two key areas that we see as really important incremental progress are happening within the Medicare program. One is what's called the Guiding and Improved Dementia Care Experience Model, the GUIDE model. And what this is a comprehensive strategy for delivering dementia care that integrates and centers the family caregiver alongside the dementia patient. And that is really a radical paradigm shift in healthcare delivery and payment. What we see in the GUIDE model is that you're not just thinking about the preferences of the patient, you're also thinking about what it takes to support the family caregiver who supports that patient. That means paying for things like respite care. It means screening and assessing that family caregiver for their needs, whether that's training or education and support, so that resources can be referred to that family caregiver. It means education as well. And all of that is part of the reimbursement model for GUIDE. So that really is an important shift in the right direction, in that we have a way of not just addressing and looking at the family caregiver, but incentivizing the system to identify, integrate family caregivers into dementia care. Now that is a dementia care model, right? So that is a movement in the right direction, but still just incremental progress. In 2024, CMS introduced new codes, what are called caregiver training service codes. That for the first time, CMS will reimburse healthcare providers for identifying and training family caregivers to deliver support as part of a care plan. This also is an important paradigm shift in healthcare, in that it recognizes that, hey, the outcomes of patient outcomes are dependent in so many instances on the support of a family caregiver. Supporting a family caregiver, training a family caregiver can improve patient outcomes. And now we have a reimbursement model or a reimbursement pathway that can build on that. And that's really critical. We know from our data at the National Alliance for Caregiving, that we lead in partnership with AARP, that over 50% of family caregivers are navigating complex medical and nursing tasks. So going beyond, the hard work of supporting activities of daily living, like bathing and dressing, going all the way to more complex tasks that historically have been provided and taken care of in acute care settings, clinical settings, hospital settings. More and more happening in the home and being performed by family caregivers, but those family caregivers are doing that without training and support. And so these new reimbursement pathways, this reimbursement or payment reform, is starting to turn the tide in terms of how the healthcare system sees family caregivers, engages family caregivers, and values family caregivers as partners in healthcare delivery. Now, that progress is happening. The backdrop of that progress also is what we just saw with the HR 1, or One Big Beautiful Bill, which is drastically reshaping the Medicaid program, which is the safety net, the foundation of providing and supporting family caregivers in this country. So I think it's important to recognize there are spots of progress, but that progress could be undermined by these policy decisions. So there's still a long road to go in terms of supporting family caregivers, but I think we're making incremental change at an important time.
Jason, as you were talking about the realities of family caregivers, I was thinking about the financial challenges that both family caregivers and older people are facing. And Diane, I'm wondering if you can share a little bit about a bright spot regarding economic security.
Sure. So thank you Thank you very much, Robert. And I think a bright spot is the fact that I'm speaking at the Alliance for Health Policy about financial security. So we at the Milken Institute Future of Aging really talk about, and it's in our mission statement, that we advance healthy longevity and financial security for all. We see it as two sides of the same coin. So to be able to talk about that. So anyway, I'll answer the question more directly. But in terms of bright spots, I mean, I think we have to acknowledge that, you know, against this backdrop, there's some pretty sobering statistics out there. 1 in 5 or 20% of Americans 50 and over have zero retirement savings. And even for those who are saving, 61% are concerned that they're not going to have enough to sustain their lifestyle in retirement. So what can we do to help pre-retirees better plan and have more programs to help with their overall financial wellness? What can we do for retirees to generate, you know, regular retirement income aside from just continuing to work? So a bright spot I want to talk about are policy changes that have been made possible by the Secure Acts, the first original that came out in 2019, and then to 2.0 that was signed into law in 2022. And that is the in-plan retirement income solutions that are embedded in our defined contribution plans and allow for a steady income stream to be, to be received in retirement to help really mitigate against the risk of running out and really outliving your savings. So some of these solutions include in-plan annuities. There is the guaranteed lifetime withdrawal benefit. These are guaranteed lifetime income streams. There's hybrid target date funds, hybrid managed accounts. We also have systematic withdrawals and managed plan options. Lots of choices here, and I don't want to go through all the complexities. Just to say that, you know, in a nutshell, these plans or these products are really going to help kind of smooth over and provide regular and steady income in retirement. They're still in the early stages, showing lots of promise. The defined contribution industry is really pushing for this solution. And it's really the larger employers that are adopting that, but we're seeing that this is as a really important incremental progress and change toward more financial security. We're also seeing more employers really offering their employees ways to model and project all the different resources that they have for retirement to really help them with deciding when to take Social Security, that benefit. In general, the later the better. And we're going to start seeing more really robust AI-powered digital tools that are really integrated as part of these defined contribution plans to give you just like real-time and personalized projections and strategies to really think through how you're going to have that retirement income all throughout your post-working years. And I would be remiss, in the previous panel, behavioral economics, here's a great application that we're seeing that's really changing the face of saving for future. And that is the automatic retirement plans, automatic enrollment. So before this, we were seeing about we're seeing now 80 to 90% of people enrolling in their plans compared to 50 to 60% without auto enrollment. And why is this so effective? When you think about the complexities, again, too much choice sometimes, right? One of the things that was challenging for participants, it's kind of overwhelming. You know, how much do I put aside? What investment, how do I allocate that investment against all these different asset classes? How do I reallocate over time? It's been made easier with the automatic enrollment. And then there are things like target date funds and managed accounts. Target date funds automatically adjust the different asset classes the closer you get to retirement. You just pick that retirement date and you just let it go. So I think these are things that we're going to see that are really going to change in terms of retirement security and future savings for particularly younger workers, lower income workers. And then actually a thing, because of the success of this, we're seeing now in 2025, mandated for any new plan that's being created by employers, these new plans have mandated auto enrollment. So before, you still can opt out, but right now, if an employer offers a plan and it's new, automatically 3% gets put aside for all their employees. And there's auto escalation, an increase of 1% every year, up to 10%. So I think this is going to really help all employees save for retirement.
Absolutely. Ariel, I'm wondering if you can talk to us about the importance of intergenerational approaches. What are some bright spots as it relates to intergenerational interventions, older adults, and the lifespan?
Yeah, I'm happy to talk about that. I just want to say, thank you for this. This is so wonderful to be up on stage with three trailblazers in the aging policy space. So, I want to really hone into the issue that you started with, Robert, which is social isolation and loneliness. This is a really core problem and really came mainstream because of the former Surgeon General's kind of focus area on social isolation and loneliness. A report of last year showed that 1 in 3 older Americans still report feeling disconnected or socially isolated in their communities. And we've really drilled down that this is a massive issue that we need to solve. And one of the emerging solutions that has come out from this crisis is intergenerational programming. I'm a fellow with an organization called Co-Generate, which is an organization that seeks to bridge age divides for a better future. And a few months ago, there was a community of practice that gathered 167 organizations from across the country who sought to build and think about how could co-generational solutions be used to combat social isolation and loneliness. And what came out of it was this really beautiful report that showed a multitude of different ways in which organizations are really on the ground doing this in communities. You have organizations like Hey Auntie, which connects Black women for across lifespan for social and emotional connection. And you have organizations like Dance Generator, based out of the University of San Francisco, that connects older adults and college students through dance. The organization that I co-founded a few years ago, the Legacy Project, we're based in 12 states and still growing. On college and university campuses, we connect older adults and college students through intergenerational storytelling. So over the span of a year, better part of a year, older adults and college students have the opportunity to learn about each other's life histories and then write about their stories that culminates in a published book at the end of the year. There's so many wonderful organizations doing this work. And we've found that they are, anecdotally, a lot of students and older adults who partake in the program find that they're more connected to the community, as well as, and interestingly, ageist stigmas that might have been existent prior to participating in the program seem to subside because they're able to better, build understanding with the olders or youngers that they get to interact with. And since we're in a room with policy people, I also want to point out that intergenerational solutions can really be a mechanism for combating the affordability crisis in housing, right? When you're talking about urban settings, especially olders and youngers, olders who aren't working, younger adults who are trying to pay off student loans and debt. There's really a need, a mechanism for affordable housing, and a really innovative solution has come out of that is younger adults and older adults living together in different settings in different urban environments. And you have that New York, NYU has a wonderful program that connects NYU graduate students with older adults in New York City, and organizations like Nesterly that is doing the same thing in Boston. And there's many other, pilot models like that across the country. And it's really a wonderful way to kind of focus not only on the social connection crisis that we're facing in America, but also addressing a really much larger issue too of housing and affordability. So I think the intergenerational mechanism can really be utilized across many different areas as a solution.
Yeah, it's really amazing. And I think about the fact that most, if not all of us, live intergenerational lives. And yet so often our interventions are so siloed by age, right? I also want to share an example from the direct care workforce. For those of you who don't know, Consumer Direction is a program in most states, all states, where if you are in need of home care support, you can hire and train your own loved one to provide that support at home. And the workers are called independent providers, and it's a model that allows for a lot of people to access the kind of care that they need. My former employer, PHI, recently did an evaluation of a matching service registry in Washington State called Carina. And Carina is one of 15 to 20 matching service registries. These are online platforms where consumers and workers can find each other based on their preferences, their needs, and their availability. And it makes that matching process just easier, right? And it really does it. So otherwise, it can be quite confusing. What they found is that Karina, by providing all of these services, 92% of consumers who were using Karina remained at home rather than entering nursing homes. And 91% of home care workers said that the platform would help them stay in the caregiving field. And this is a workforce where turnover is around 100% within the first 90 days. So when we think about best practices, we really should elevate matching service registries. These have been really impressive bright spots for the field. And I'm curious if we can talk a little bit about what would it take to bring them to scale from a practice side, from a policy perspective, or from other perspectives. And I'm going to start with you, Ariel. What would it take to take those intergenerational models to scale?
Yeah, that's a fantastic question. I see three main barriers to scaling that I think will have to be overcome to really see this on a nationwide basis. The first being standardization of data collection. There's hundreds of intergenerational programs across the country in cities, towns, you name it, and hundreds of different ways in which those programs are measured, which is fine, except for the fact that we're trying to demonstrate a kind of a nationwide impact. It's hard to see what is the overall effect of these intergenerational programs in aggregate. And to be able to make the case to federal, state lawmakers that there should be funding in these spaces, we have to have that data, and for grant applications and for a multitude of different things. So there would be much more power if we were able to kind of have a standardized data collection process. Leading me into the second piece, which is funding. As of right now, to my knowledge, in the United States, there's a single foundation that focuses solely on intergenerational programming, and that's the Eisner Foundation. And there are a multitude of other, organizations who support younger adults or older adults. However, this focus on intergenerational programming is largely missing in the grant-making space. And so there really needs to be kind of a honing in on how can we put more funding resources towards these programs, whether that's through other organizations prioritizing intergenerational programming or through government mechanisms, right? Like Senator Chris Murphy a few years ago proposed a national strategy for social connection. This would put resources into this type of work. It didn't go anywhere, but if we were to, move forward the needle on doing that, that could really benefit on the funding piece. And the last thing I think is a little bit less tangible. It's more on the culture change, right? There is real generational tension. There is, I see it all the time, the Legacy Project, olders and youngers that partake in the project going into it feeling as if they aren't going to enjoy it because they haven't ever connected with an older younger outside of their own family member before. And I think a large part of this is perpetuated by the media, by the 2024 election cycle and the concentration on age, by the talk of Social Security not being there in X number of years, right? And so there's a real importance of media organizations, large-scale organizations, influencers who are on TikTok and social media to be able to talk about age in a positive way, to talk about these age gap friendships and the why people should partake in them, because I think that will really make all the difference in terms of people wanting to engage in these types of programs.
Mm-hmm, absolutely. Diane, what about you? How do we scale economic security initiatives?
So I'll talk about, again, the in-plan retirement income options. I think we'd have to redesign them from a policy perspective so that income is a default. So think about income being the default for withdrawal. You can think about partially annuitizing, part of your plan or having managed payouts. And there is real consumer demand for this. There was a TIAA Nuveen study recently that showed that 93% of their plan participants want to see retirement income options in their plans. Allianz did a study, I think just this past spring, that actually showed the majority of their members also wanted the retirement income. 70% wanted some kind of annuity option in those plans. So you see that demand. You could also see having things like, instead of doing a lump sum at retirement, just, partial or ongoing payroll deductions throughout the time so that you're slowly contributing to that annuity. So I think these are some of those ways that they can scale. They're still relatively new. I was looking at some statistics, anywhere from like 18 to 14% of plans have this option. We're going to see that grow. And then the more, just like we saw auto enrollment kind of piloted and now mandated, I think we can see some real benefits to scaling here.
Absolutely. Jason, what about family caregiving?
Yeah, I think there are two key opportunities for scale. One is a little easier than the second. Well, it's prioritization, right? How do we prioritize family caregivers as part of the policy decisions that we're making? Take CMS, for example. The guide model is great, but it really only applies to individuals navigating dementia. There are so many other complex care condition areas where family caregivers are essential to the outcomes of the patient. And we should also be investing in the caregiver regardless of patient outcomes because they themselves are Medicare beneficiaries in lots of cases, right? So how are we better integrating caregivers into healthcare delivery simply by prioritization and thinking about integrating and assessing the impacts of our decisions on family caregivers. Guide gives us a model to do that across other innovation-based models. There's dozens of innovation-based models being tested right now through CMMI. Only Guide, as of today, prioritizes and formally acknowledges the family caregiver. Now, CMMI just released a strategic plan and vision for the next 4 years on how to make America healthy again. And one of the important shifts in that plan is a formal recognition of the importance of the family caregiver. So another bright spot there, and we need to continue that in order to scale across other areas. Two, on the caregiver training services, we've seen initial data that shows utilization of those training codes is very minimal at this point. They're still relatively new codes, but there's so much more that we can be doing, that CMS can be doing, that Medicare Advantage plans can be doing to integrate those codes into provider practice. So I think that's an important opportunity. But I think all of that is really dependent on a paradigm shift that we need in this country. A paradigm shift around how we value family caregivers. Culturally, we really look at family caregiving, and the policy we have around family caregiving looks at caregiving as an individual responsibility, not a shared opportunity that we all rely on and benefit from. And so it's that paradigm shift that we need to make in order to scale these solutions.
Absolutely. It seems that hope these days is so important, right? Hope can really be a radical act, and it can be a transformative way for us to think about the future. I'm wondering if each of you can take 1 or 2 minutes to tell us what gives you hope these days.
What gives me hope? Well, we're seeing increasingly this conversation around the importance of prevention. So right now in the United States, we have one of the largest gaps between health span and lifespan, 12.4 years, meaning almost a whole decade spent in marginal health. When you're paying for health care, that's going to whittle away your retirement savings. So, a couple today that's 65 can expect to pay $472,000 in out-of-pocket expenses for health care and long-term care. But the healthier you are, you're not going to dip into that. So my hope is that this focus on prevention, we know so much about how to prevent, for example, dementia, 14 modifiable risk factors that can prevent up to 40% of dementia. That goes hand in hand with your financial security, how to really increase health span, years living good health, and increase wealth span, those years of financial stability.
Thank you for that. Jason?
Yeah, well, I agree. Hope is important. Hope is a tender weed, right? It's always finding a way. And I think for me, when it comes to family caregiving and supporting family caregivers, I see hope and opportunity in states doing the work that the federal government is waiting to do at the national level. When we see states like Washington, we've talked a lot about Washington today for good reason, right? Washington State not only established a first long-term care program, it went into a ballot initiative, right? Because folks wanted to make it opt-out. And that was voted down by the voters in Washington State, right? We've seen red states like Nebraska establish caregiver tax credits, right? Caregiving happens, a lot of out-of-pocket costs. Those out-of-pocket costs are not recognized by the tax code, and so states are starting to make that change. 13 states in the District of Columbia have paid family and medical leave policies, where we're still waiting at the national level to establish a national paid family and medical leave policy. So what that tells me is that when care is on the ballot, it wins. And that gives me hope because progress is possible even in the divided times that we're in now.
Mm-hmm. Ariel?
Yeah, I think for me, it's really, the intergenerational innovators that I get to surround myself through my work at CoGenerate, all of their community of practices. A few weeks ago, there was actually the Generations United did a conference in Kentucky, bringing together hundreds of intergenerational innovators or individuals looking to get into this space. It's the students and the older adults who want to partake in the Legacy Project and to be a part of this work and get to build those connections with individuals that are a different age than them. For me, that's what brings me hope, because it's that passion and energy that knows that this movement's going to propel forward. So
That's excellent. I think about spaces like this, right? I think about the importance of, even in tough moments, being able to bring together passionate thinkers and advocates and policy analysts and so many others to take a step back and think about, for today's example, aging and older adults in the context of health policy, and to end the day summit on thinking about best practices so that we can replicate what's working as a countermeasure, right, to everything that's not. I think that that's such a critical and courageous way to have that conversation, and it's been a real joy to be able to have this conversation with the three of you. Any final words for our audience before we open it up to questions?
Just keep doing what you're doing.
Thank you.
We need all these voices in the room and then some. Our older adults, someone talked about ageism. I do think that is a real root cause to the just consistent avoidance to really deal with putting in the right policies, supports, and practices. We're not prepared for our aging society. And it is a global megatrend, population aging right up there with AI and climate change. So, raise your voices and be really active in this conversation. We need everyone to really understand that we need to shift the narrative of aging, because it's not about decline. It's about purpose, wisdom, and happiness.
Mm-hmm. Amen.
So, yeah.
Jason?
Yeah, I would just build on that. Tell your stories, right? I spend a lot of time working on and looking at data, but data makes you credible, stories make you memorable. Right? And this really is a time where lived experience and storytelling is really critical. And so I encourage you, so many folks raised your hand when I asked about your caregiving experience. Those are all stories that have power and are needed right now in this moment.
Thank you.
I think my last point would be to break age silos as much as possible in your own communities, form connections with individuals, different generations than you, and co-learn from one another. That would be my biggest takeaway.
Yeah. And for me, it would be, let's not forget the workforce within the long-term care system, their realities, their aspirations, their needs, because they are so central to how all of this functions. I think we're going to open it up to questions now. Any questions from the audiences? Yes, right up here.
Yeah, so thank you for this wonderful day. And I think the whole meeting this panel was great, but the whole meeting was really successful in showing, number one, this is an urgent, important issue we have to deal with, and ways that people are overwhelmed, throw up their hands, and nihilism, there's nothing we could do. And I think this showed that there's like a ton we could do. So I have one comment and one question. So my comment is we also need the research. We need the evidence base about what works and how to implement it. And so we need support for research to move all of this forward. And my real question for the panel is, given these uncertain times, there's so much policy can do to kind of, foster this. So what are your suggestions, policy at any level, federal, state, or local, to be able to move this agenda forward?
So I'll start. Thanks for that question, Arlene. I think Jason said, too, a lot of the innovation is happening at the state level with the support. Washington State being a gold star, I think, between Corina and Washington Saves, their long-term care program. I talked a little bit about the automatic enrollment plans. States are now mandating, they're really leading on mandating retirement plans for for the 57 million people who do not have access to an employer-sponsored retirement plan. 20 states so far and growing. So that mandate alone is going to increase a number of plans that are happening. And so, one of the unexpected outcomes that we're seeing is that some of these new companies, particularly the small businesses, that they don't want to be forced to participate in their state mandated plan. So they're actually creating their own. And there's all these great fintech solutions out there that are helping make it really easy for small businesses and micro businesses to start up these plans. So some good forces that are happening at the state level.
Mm-hmm. Either other responses or other questions?
I would just add one thing. I think, again, picking up on the theme around state innovation and state implementation, I think you make a really good point about implementation science. And I think that's where, from a care perspective, we're going to shift and need to focus as a movement. Really now is this reality that now there are unprecedented work requirements that are going to be part of Medicaid health delivery in this country, and that's going to be a mess in terms of implementation. So really thinking about how do we support policy where we do the least harm as these work requirements are being implemented state by state. And I think there's opportunity there and an urgent need to ensure that we inflict the least harm, particularly for family members who are providing care for older Americans and other people who rely on home and community-based services to make that care possible.
Mm-hmm.
Yeah, and I will say, I think right now, all intergenerational programming is happening on the grassroots level. It's individuals who scrap together resources from a multitude of different places and who care so deeply that they want to pursue this work. There's really no top-down level funding from government sources. So as I mentioned earlier, I think whether that's on the state level or federal level, having a national strategy for intergenerational connection, having opportunities to apply to grants specifically focused on intergenerational programming would make all the difference.
Mm-hmm. Thank you. Any other questions? Oh, in the back.
I'm sorry, I'm not familiar with your term, Karina. How do you spell that?
Oh, the Matching Service Registry is CARINA, and it's in Washington State.
Thank you.
Sure. Well, let me ask another question as we wait for, oh, there's one? Yep.
Hi, thank you for hosting the hearing. I have a follow-up question, honestly, for Diane, but I'd love to hear from all of y'all. For these really wonderful private sector accounts, you said it's a lot of larger employers doing them, which is fantastic. I wonder if y'all see a lot of opportunity and availability for folks that work more on a wage basis rather than a salary basis for some of these private-based retirement plans, because I think that's where we see a lot more reliability on Social Security.
You're absolutely right. And that's where the gap is. There's about 57 million American workers who don't have access to their retired plans offered through their employers. And there are a lot of things that are happening to really close that gap. The state mandates that I mentioned earlier, there's tax incentives actually too built in to the Secure Acts to really allow for tax credits to really take into account any type of cost for the setup, the provisions for setting that up, to really help close the gaps. And then this new in-plan retirement income, we're going to start seeing that really getting embedded in the plans. It will take a few years, but as we learn, just like we saw the impact of the behavioral economics around just automatically enrolling someone, when you start having automatic defaults and withdrawals or retirement incomes as part, that's going to become part of these plans, but it will take a while.
Yeah, I would say I think that's a disparity that we see across multiple policy issues, right? One of the issues I work really closely on is paid family and medical leave. And we live in a country where it depends on what state you live in or what employer you have, depending on and the size of that employer, on whether or not you're able to take paid time that you need to provide care for a newborn child or a dying parent, right? And so that underscores the importance of federal level action that recognizes that care has value, and it values both employers, states, families, and the economy as a whole.
Other questions? Yes. I think a mic.
Do you want this one? Okay. Oh, thanks. It's not really anything I know anything about family caregiving, but my impression is that a lot of family caregivers appreciate when hospice is eligible, when the person that they're caring for is eligible for hospice. And I'm just wondering if that's a policy level lever, because if hospice could be kicked in under a broader set of conditions, that might help. I just thought it might be a policy thing.
Yeah, absolutely. I mean, we see hospice is a great area where there's a tradition and legacy of identifying and supporting family caregivers as part of hospice care, models in palliative care more broadly. I think there's a lot of education that needs to be done around the value of hospice. What is hospice? How is it different from palliative care? We are supportive of a piece of legislation called PACHITA, which is a palliative care, expanding palliative care education and training, with hospice being a part of that educational process. But I think that is definitely an area where we can, health parts of the healthcare system can learn from hospice care delivery and how to better support family caregivers.
Mm-hmm. Great question. Yes, back here.
Hi, my name is Rebecca. So I was wondering, how can policymakers reform auto enrollment? Because I have spoken to a few individuals who are retirees that they were forced into like Medicare Advantage programs while they were retired, and they probably had like the option to opt out like in a year, but some people are not like very educated on like the different plans. And then once they got sick later on in the future, they realized like the detrimental impacts to these plans. So what are some ways that policymakers can probably like reform like auto enrollment?
I'm actually not familiar with auto enrollment in Medicare Advantage plans. I mean, as you're nearing 65, you really have the option to sign up for a traditional Medicare fee-for-service or enroll in a Medicare Advantage plan. That said, the Medicare Advantage plans, which are offered by private insurers, are marketing the crap out of their programs and probably calling people. So there could have been something that happened there where someone was unwittingly auto-enrolled. So it's definitely something that should be on the radar of policymakers to make sure that that's not happening. But that's what the Consumer Financial Protection Bureau was designed to do.
Mm-hmm. I think one of our audience members might know a little about this issue. I see her with an eager hand up.
Hi, sorry to hijack. That person was probably in an employer group waiver, which is a policy issue, and it is a benefit that retirees can be auto-placed into. Policymakers are talking about it, but it is different than the Secure Act, while they are both under the jurisdiction of the Finance Committee and the Ways and Means Committee, if you're looking for people to talk to.
Thank you so much.
Thank you.
We are out of time, so I want to take a moment to thank my fellow panelists, Diane, Jason, and I'm sorry, Ariel. Thank you. Thank you so much for your contributions and for all of your guidance, and thank you everybody for listening.